Good morning, everyone. I'm Catherine Brookman, Associate Director, Knowledge Transfer and Exchange, and on behalf of Dr. Jack Callahan, Director of the Center of Research Expertise for the Prevention of Musculoskeletal Disorders, or CRE-MSD as we are more commonly known, we'd like to thank you for joining us today for this free webinar about factors you should consider when completing computer work and recommendations to optimize your wellness at work. We are grateful to the Ministry of Labor, Immigration, Training and Skills Development for our funding, which supports the delivery of these webinars, and to our presenters who provide their expertise. We ask that you keep yourself muted for the duration of the webinar as a courtesy to the presenters and all participants. The format of today's webinar is as follows. The presentation will be given, after which time we will have 10 to 15 minutes for a question and answer period with our presenters. During the question and answer period, we ask that you type your questions into the chat box. The chat box can be pulled up on your screen by selecting the chat icon in the control panel that appears near the bottom of your screen. I will relay these questions to the presenters or a similar theme should we have duplicate questions. Should you have a pressing question or issue such as a technology glitch that cannot wait until the end of the presentation, please type this into the chat box and we will do our best to address it right away. This webinar is being recorded, with the recording being made available to you on our website along with the presenter's slides shortly after today's webinar. You will also be sent a link to an evaluation. Please fill out this evaluation as it will assist us in the future delivery of our webinars. Thank you so much for joining us today, and remember to watch the CRE-MSD website and the MSD prevention site for other webinars with this theme of remote work, resources, and events. Now it's my pleasure to introduce to you our presenters. Dr. Phil Bigelow is an associate professor in the School of Public Health Sciences at the University of Waterloo with a background in occupational epidemiology. His current research interests include musculoskeletal disorders in the workplace, interventions in occupational health, evaluation and measurement of health and safety management systems, risk assessment, interventions to improve the health of workers in high-risk industries such as transportation and construction, and the health and wellness of truck drivers. Kim Meszaros is a certified professional ergonomist and the ergonomics research coordinator at CRE-MSD. Kim's main focus is maintaining and developing the MSD prevention guideline for Ontario and collaborating with stakeholders to share and create MSD prevention resources for workplaces. She is also the principal ergonomist at Connect Care and the National Student Committee Advisor for the Association of Canadian Ergonomists. Now it's my pleasure to hand this presentation over to Phil.
Well, thanks so much, Catherine, for the introduction, and thanks everybody for joining us today. So Kim and I will be talking about a survey that was done this year, looking at the mental and physical health of remote workers, and we're really happy to provide the results. So I'll talk first about the methods and the findings, and then Kim will we'll talk about really the recommendations. You know, Kim is an ergonomics research coordinator at CRE-MSD. I'm also a scientist at CRE-MSD as well. So Kim will come in at the towards the end of the presentation and really talk about how these findings apply to work during the pandemic here now, and I'll actually post pandemic as well. So first I'll go through the study motivation methods, the sample, the analyses and the finding, and then Kim will come in with the recommendations. That'll be what we'll be talking about today. And then at the end, we'll have some, as Catherine mentioned, some time for a Q&A at the end. So why did we do this study? There were a few studies conducted at the beginning of the pandemic, and I'll talk about these in a couple minutes later in a little more detail. But the health and safety system in Ontario was interested in understanding kind of the state of the system, how workers are faring, still being at home after a year of the pandemic. So we came in kind of after some of these initial studies, used some of the tools that they used in assessment of the current state of teleworkers and their health and wellness. We wanted to take a holistic approach, and our research did concentrate quite a bit on physical factors, and Kim will talk about the recommendations, especially related to the physical work setup and how CRE-MSD and the guideline can help with improving the physical factors in working from home. Also, we wanted to, of course, include psychosocial factors and impacts on mental health and stress levels. And also, there is, of course, an issue with organizational factors. Organizational factors are always important for health and wellness of employees. And these factors can be challenging when work goes home. These are challenging things to keep work engagement from the organization. So we did measure some of those, and we'll talk about how those interact with the physical and psychosocial factors in affecting mental health of employees. And finally, we did ask some questions about individuals' intentions to return to the office, and so we'll provide some recommendations for what employers can do to help with this transition, whether it's a hybrid or totally going back to the office. We'll talk about that. So here's the structure of our survey. So this is an online survey conducted using Qualtrics software. And we did this from the survey was online from March to May of this year, so 2022. And as these previous surveys, we used some of the validated instruments from these surveys. One of them being the Canadian Institute for Safety, Wellness, and Performance out of Conestoga College. Their survey had a number of validated scales that we used. Another one was a survey conducted out of the University of Cincinnati, and we took some scales from there. And there was also a personal support worker survey that had some questions that we used that had been tested and validated previously. And finally, we took the desire to return to the office questions from a study out of West Sweden Public Services. So those things all went into what we tried to do in designing the survey is make this holistic, but not too long, because we did want to keep up the sample size by having people not take too long to fill out the survey. So we did borrow these questions from a number of other sources, and basically what happened was we used our connections in the system to encourage distribution of the survey, and our stakeholders were very helpful in terms of getting the survey on their websites and using their social media to promote the survey. And so it worked out very well in terms of getting a sufficient sample size to do these analyses that I'll talk about right now. So first of all, I wanted to talk first about the sample size, the demographics, and the working arrangements that we found from the study. First of all, in terms of gender distribution, we found, we had 72% of the respondents of just over 1,000 total respondents in the survey that were female. And this actually is similar to findings from the Canadian Institute for Safety, Wellness, and Performance study. And that study actually has just been published just in the last month or so. It's in BMC Public Health. So their survey also had 70% of the respondents being female, and they're looking at health and wellness of remote teleworking at the beginning of the survey, as I mentioned, beginning of the pandemic, as I mentioned before. So age distribution, this is just as we kind of expect. Most of them in the mid-range of people's working life. Fewer at the ends, the younger groups and the older group. So that's a kind of a normal distribution for age. In terms of locations, most folks were in Ontario. Um, the survey link was distributed to mostly workplaces in Ontario, but some organizations did have work sites outside of Ontario and outside of Canada, and we did get some respondents from those locations. So the survey is quite generalizable to Ontario, given we have the largest percentage of folks who responded to the survey from Ontario. In terms of the demographics, education and training, healthcare and social assistance, public administration. These made up the biggest proportion of respondents, and that probably does reflect the fact that lots of office workers in the sample, and lots returning, forced to work from home at some point during the pandemic. And that was a requirement for participation in the study, that you're an office worker, that you spend some time during the pandemic at home, when you didn't used to do that previously. So that was the goal of the sample collection. In terms of survey demographics, of course, large companies gave us the most sample size, and these actually translate into percentages here pretty nicely, since we had around 1,000 respondents, 1,002 for many of our analyses, but like 70% were from large companies over 100 employees, and very few in the micro category of less than 5. And this is typical of many online surveys of workers. So in terms of the main positions, as expected, most were non-managerial employees at 52%. And this is similar to, maybe a little lower than the survey from Conestoga, but in that same range. Most workers were non-managerial, some managers, directors, and supervisors, but the majority non-managerial employees. In terms of working arrangements during the pandemic, 97% of the workers reported a change in their working environment due to the pandemic, and that was the kind of a goal of the sample, anyways. 58% were required to work remotely for greater than 12 months during the pandemic, and 72% reported working in a hybrid work arrangements for some period of time during the pandemic. 70% were never in the office full time during the pandemic. So this just shows you the hotter colors. The red and yellow is never, and sort of smaller amount of times being in the office. But that's just the highlights of where people were working. In terms of hours of work, we were wondering, what happens with people's hours of work. And so basically, really, there wasn't that much change during the pandemic, except that full-time workers reported more overtime work, which is interesting. In terms of the part-time and casual work, those percentages didn't change much, but didn't change too much. But we did see this interesting thing that more overtime work during the pandemic as compared to before the pandemic. So these, and we just remember that we're asking people about, we're asking them these questions during the pandemic, and so we're asking about what you're doing right now during the pandemic, and we also ask questions of them at that same time, though, what were they doing before the pandemic? So it was all at one time, a cross-sectional study, but we asked them what happened in terms of their work situations prior to the pandemic. So this is where, in terms of the work environment, the good thing is the majority have their own space in a separate room. So we're asking them about their work environment. And so, and some of these other responses were recorded. I have my own place, but in a room that's shared with other people. I just find a place wherever it's free in the house. But the good thing is the majority, 68%, had their own space, separate room by themselves in the house. So that's probably a good practice for folks who are working remotely. In terms of the devices, we're very interested in the devices that people used. 73% of respondents always used a laptop. And this is similar to other studies. The Cincinnati study by Girding et al. In 2021 at the beginning of the pandemic also had around 70% of respondents always using the laptops. And of course, previous studies kind of in the ergonomics area have shown that laptops are associated with awkward postures, arms not supported. So these risk factors for musculoskeletal disorders. And we'll talk about this relationship of these devices with those MSDs in just a couple of minutes here. So in terms of general health of this population, we asked some questions. We didn't have a lot of questions on these particular areas. So we did, we really used single item measures for a number of these. These are validated measures. So we asked people generally about their mental health, and we just asked them to rate their mental health on this scale here, which is poor, fair, good, very good, and excellent. So here we have a graph showing before the pandemic and during the pandemic. And what's highlighted here is the positive, good, and very good categories. And so we have less good and very good responses during the pandemic as opposed to prior to the pandemic. So the pandemic we see is having some impacts on self-reported mental health from this validated single response measure. And this measure actually comes from the Canadian Community Health Survey, so it's a widely used measure of mental health using a single item. So in terms of when we look at the data a little more closely and we look at the scores before the pandemic, we have these mean scores of above 2, which is between good and very good. And during the pandemic, it drops below good in terms of the mean, and that difference was statistically significant. So there we see the statistical test. This is a paired t-test to compare the mental health, self-reported mental health of these 1,000 individuals during the pandemic and prior to the pandemic. Self-reported physical health, again, we used a single item measure of physical health, and this is also from the Canadian Community Health Survey, a one item scale here. And again, the highlighted boxes here are good, very good, and excellent. And same as with the mental health, we see poorer self-reported physical health during the pandemic. These boxes are bigger during the pandemic. And to be more precise, 89% positive responses before the pandemic, and then it dropped to 66% of positive responses during the pandemic. So the mass of those boxes is smaller during the pandemic as opposed to before. And when we do the same scoring, we get before the pandemic we were above good, and then it dropped below good during the pandemic. And that looking at the scores, the mean scores, we see a significant difference during the pandemic as opposed to before, with it being worse during the pandemic. Self-reported stress levels, single item measure of stress, self-reported stress. Before the pandemic, we had 18% reporting high levels of stress. So these questions are the highlighted boxes are very stressful and extremely stressful. And so before the pandemic, we have 18% reporting high levels of stress. And during the pandemic, that rose to 55% reporting high stress levels. These are overall stress levels of the individual, so including kind of it's just their overall level of stress from that single item question. So it integrates stress from multiple sources. But we see this is not great, quite a bit a rise in stress. And then here's the numbers for that. During the pandemic, the stress level, looking at the numbers, was significantly more higher during the pandemic as opposed to before. So looking at stress-related symptoms, we used some validated questionnaires from other surveys that I mentioned at the beginning. This one is from a survey in healthcare, PSW survey of stress and health impacts, and these are the averages, the means for each of these. These are Likert scales for each of them, and we see that these things line up kind of as we expect, and the p-values are based on a paired t-test, and exhausted at the end of the day. We see that as being significantly different and increased during the pandemic. Headaches or migraines increased during the pandemic. So these things are going in the direction that we expect. Able to sleep through the night, it gets worse during the pandemic. So people are having more sleeping problems during the pandemic. Energized while working, we see less energized while working during the pandemic. So these things actually, these symptoms of stress at work and overall stress are really increased during the pandemic as opposed to prior to the pandemic. And all these values are statistically significant. So everything is lining up here to provide evidence that stressors during the pandemic were worse than these types of stressors before the pandemic. And we also asked about physical activity, and in terms of, again, we had just the one question on physical activity about the level of physical activity, and did it change? So we asked this in one question. It really was about how was your physical activity level before the pandemic versus during the pandemic? And the yellow bar in the middle there stayed about the same. And a number of people did have somewhat more physical activity during the pandemic, but the majority of folks had much less physical activity, or somewhat less physical activity during the pandemic. So we see the pandemic is makes it more challenging for people to get physical activity. And so those were significant differences prior to the pandemic and during the pandemic for physical activity. So how does this translate into? We have a lot of risk factors here that are kind of lining up the wrong way for these for the health and well-being of folks that are forced to telework during the pandemic. So here we have reported pain. So we asked standardized pain questions, severity and frequency of pain, and the hotter colors in this figure are pain that occurs more often. So if we see the red, orange, and yellow bars, the bigger that those things are, that's more often reporting pain constantly, frequently, and occasionally. We really want to see it never being reported. And so, but during the pandemic, we see neck, shoulders, and lower back with high prevalences of reported pain. So those are the big areas. This is very similar to that Cincinnati study where pain was most frequently reported in the head and neck, the upper back and shoulders, and lower back. So our neck, shoulders, and lower back are very similar to what the Cincinnati folks found for teleworkers. And again, this is most likely due to these workstations and improper use of these devices, not in the best posture and not in the best setup for home offices. So when we look at the mean pain frequency, here's the graph of before the pandemic in the light blue, during the pandemic in the black, and we see that the frequency of the pain is increased for all these during the pandemic in each area of the body, and and all these differences, each one they were all statistically significantly different. So we see more pain across all areas of the body, not only just those main areas that we talked about before, back and neck and upper body, but but all areas of the body we see more often reporting pain during the pandemic as opposed to to during the prior to the pandemic. So what about injuries? So that's self-reported pain. There are folks who reported injuries during the pandemic. We're asking this question, so it's a self-report about having an injury. And so most people, 80% didn't have any injuries, but 10% and around 10% also 10% had mental injury, and around 10% had physical injury as well. So the types of physical injuries, sprains and strains were as expected, quite a percentage. Sprains and strains. So most of these are more gradual exposure, MSD, RSI causes of this physical injury. Less acute physical injuries, mostly more chronic exposures. That's what we expect in this office work environment. So what we asked the question, was the injury that you talked about, was it reported to your employer? And so 41% said no. 59% that reported an injury said that yes, it was reported to the employer. And so we wonder, would this be different? And we're going to be doing a little bit more work in that area in terms of reporting to employer and what percentage of injuries, when people report that they have an injury, do they report it to their employer? And this next part of the slide talks about if a claim was submitted. And this is divided by physical injury and mental injury. And we see differences here. 70% of those with physical injury reported an actual claim. Of these people who reported to the employer, 70% ended up going to a claim. And for mental cognitive injury, 63% of those ended up being a claim. So overall, 72% of all these injuries reported to the employer ended up going to an agency like the WSIB for an official claim. So, and actually, that's probably, those rates are kind of, I guess, what we might expect. The mental cognitive being a little less, and maybe that's due to kind of issues of recognition of mental health injuries in the workplace. I expected that actually to be a little bit lower. 63% is pretty high. I thought it might even be lower than that, given the stigma around mental health injuries. So in terms of organizational support and work organization, we asked a few questions about that because these are important factors for both MSDs, musculoskeletal disorders, as well as mental health in the workplace. So was support provided by the employer? 72% of respondents said yes, something was provided, and some others didn't. And here's what was provided, provided by the employer. The biggest category here was allowed to take equipment home from the workplace. So this was you could take stuff from your workplace home, and then other categories were less. And you can later on you could check the slides if you want to look through all these individual things that were provided by the employer. And Kim will talk about that a bit later in terms of what are the best approaches for providing support to workers. So we did ask this question about preferred work arrangements. So this is a work organization question. How would you like to kind of work after the pandemic, when we don't have any COVID anymore, whenever that's going to be. The biggest category was most folks wanted to work from home 5 days a week. However, overall, when we add up all the categories, most people wanted to have some sort of hybrid work arrangement from 4 days per week to 1 day per week. Like a very small percentage really wanted to go back 100%. So this is the new kind of way here. This is the preference of people, is to really have a hybrid work arrangement. So that's what people were reporting at sort of March of this year. So we did some more detailed analysis, and we had these research questions. What work from home factors are associated with mental health? So we've already talked about all the measurements we've taken in the study. When we put this together into a model, we have we asked a number of questions on organizational support, and these are the Pearson correlation coefficients with mental health. All the correlations are positive, indicating that all were related to improved mental health. So all these factors: experiencing, feeling part of a work community, receiving support from the supervisor if needed, all these are positive. The correlation coefficients are positive, indicating that these are associated with improved mental health. Received training, and so the magnitude of the association is in that number. The highest being experience of feeling part of a community at 0.22, and other ones a little bit less. Training is important. It's related with positive mental health. So here's when we put this together, psychosocial and psychological and psychosocial factors associated with mental health in these models. What we find is we can look at the factors that are associated with worsening mental health: stress level, exhausted at the end of the day, headache or migraines. These are what we expect. People reporting these symptoms related to mainly stress-related symptoms. Stress-related factors are negatively correlated with the mental health, and so that's kind of expected. Factors associated with improving mental health: feeling energized at work, in control of your life. So job demand, job control is going to be important. Perceived satisfaction with the home workplace workstation setup is positively associated. More comfortable workstation. So these factors in particular are associated with improved mental health. Putting this all together, this is just a schematic showing these psychosocial factors associated with mental health. So these are things to focus on. And the interesting thing is what we found is these actually mirror the 13 psychosocial factors for psychological health and safety in the workplace from the Canadian Mental Health Association. So that's a publication that looked at these psychosocial factors. And so this study really provides evidence for these factors being important for improving the mental health of the workforce. So it fits well in there, and all these things match up nicely. Positive organizational culture, job control, management support, training, workload management, work satisfaction, work-life balance, all important in mental health, and that came up quite clear in our study. So here's a bivariate analysis of. And we used Pearson's correlation to identify associations. Physical health and physical activity level were positively associated with mental health. That makes a lot of sense. And one thing about this finding is that movement really makes a difference. Postural changes and the duration of active movement during the workday is correlated with improved mental health. So that's the take home from these particular analyses. So movement and physical activity level, a good thing to do in terms of if you can do it during the workday, improved mental health. So here's the predictors of positive mental health. This is a multiple linear regression here. So this would control for gender and age in this particular analysis, and we find that This is feeling part of the community, going to be a positive impact on mental health of the workforce. Fear, being anxious or fearful, a psychosocial factor, is negatively associated with mental health. So we have kind of these things translating into the modeling after we control for demographic factors in these things. Feeling control of your life, positively associated with mental health, and stress levels negatively associated with mental health. So most of these things line up pretty well with what we expect in terms of the modeling. So our final research question here is what factors associated with pain in these three top body areas. So we're very interested in the setup of the office, and so here's just a quick slide, not a quick slide, but it's a slide showing these various workplace factors. And one of the key thing is using external devices when working on a laptop is associated with reduced lower back pain. So if you have a laptop, having a monitor is going to really help with low back pain. So that's the office chair was the only type of chair there were people reported all kinds of different types of chairs that they used, but the office chair was the only type of chair associated with reduced back pain. And when in the seated position, if the back is in contact with the backrest, that's going to be associated also with lower back pain. And in terms of the desk, a traditional desk was associated with reduced back pain, but that's compared to sitting on a couch and sitting on the dining room table or something. So that's kind of expected. These things. So the work environment is important. So here's the factors with increasing lower back pain. That's kind of the opposite situation here. The kitchen, dining room chairs, all these things that not the best design of our home office is a cause of increased lower back pain. And also here we have the postures. Neck bent forward, neck bent backwards, neck twisted or bent sideways. These things are related to increased lower back pain. So these things should be considered. So really, assessment of the work office from an ergonomist is really what really needs to be done here. And this just shows, again, psychosocial factors and the work environment related to reducing back pain in the top three body areas here. And then the other slides were really about back pain, but this is putting the top three body areas all together. It summarizes appropriate equipment, proactive support, and we do have a finding of proactive support is more important than reactive support in terms of health. The employer is better to be proactive because that's associated with a better improvement than if an employee has to kind of request something that's more related to actually having pain, which makes sense. Proactive support is going to be better in terms of reducing pain. So doing this right up front. Job control, organizational culture, training, workload management, work-life balance is very similar factors associated with pain in the study as well. So here's just some common factors associated with pain in these areas. Office chair is going to reduce pain. Work pacing and breaks, it reduces pain as well. The things that increase pain are these household furniture, temporary work surfaces, working in non-optimal postures. These things are not the best for us. So I wanted to leave it with Kim at the last bit here to take these. I'm the epidemiologist, not an ergonomist, so Kim will take these findings and put them into recommendations and conclusions.
That's great. Thanks, Phil. Thanks for giving a summary of the analysis and the survey. So first part, I'm going to just summarize what we've went over. So compared to the pre-pandemic condition, self-reported mental and physical health for individuals working from home was worse, and reported pain was more often reported during the pandemic across all body areas. Also, similar trends for workstation setup and body discomfort were identified compared to previous studies on working from home. And those studies were done in earlier stages of the pandemic. And this is concerning because this survey was conducted 2 years after the onset of the pandemic. So if we're considering remote work being a part of the permanent working arrangements going forward, necessary interventions are required to improve mental and physical health for remote workers. And finally, the analysis indicates that self-reported mental health was primarily impacted by psychosocial and individual factors, whereas body pain was associated with a variety of different types of factors, including physical factors. So, based on the results from the analysis, we summarized some recommendations for employers on setting the foundation for positive mental and physical health in remote workers. So the first step is management commitment and demonstrating leadership. So we want to make sure that there's organizational commitment outlining how to protect remote workers, and that this could be done through company policies. Developing very clear expectations around what is entailed with remote work. So looking at defining work hours, outlining tasks and deadlines. So these types of expectations can reduce uncertainty, which may result in stress and frustration. So we're trying to minimize that. But we also want to encourage work-life balance to avoid burnout as well. So that's why those expectations are important. Focus on creating a positive organizational culture. So we want to develop a supportive work community built on trust, honesty, and respect, and encourage open communication between staff members and with management as well. And then finally, provide workers with supports to perform their jobs safely. So investment in supports such as equipment, training, and resources that can protect health and safety can also be associated with increased productivity and quality, along with injury prevention. So when it comes to an employer's responsibility to protect workers from hazards in the workplace, MSD hazards in the remote office should also be treated the same as any other type of workplace hazard. So we're recommending developing a plan to support remote workers in the remote office. So the first step would be include some training for employees on awareness and awareness of musculoskeletal disorder hazards and psychosocial factors that are in the remote office, as well as how to report hazards and any symptoms identified when you're working remotely. Controlling hazards through optimal setup and best practices. So I'll go through a couple different resources at the end. And then create a process for hazard identification, assessment, and control. The process allows the organization to understand the hazards that are in the remote workstation and help them develop effective controls to mitigate those hazards. Next slide. So some considerations for anyone who is working remotely. It's important to respect boundaries for work hours and personal time to help with work-life balance. Secondly, contribute to a supportive work community. So supporting peers when you have the available time and asking for assistance when needed will contribute to a positive organizational culture, and also participating in open communication as well. Reference resources for optimal workstation setup, and this is to mitigate MSD hazard exposure in the remote office, and using equipment as recommended to complete your tasks safely. And I'll go over the quick start guideline for office in a few slides. And apply best practices and work methods. So including movement in your workday, making sure you take regular breaks, and then finally reporting hazards and symptoms to allow the organization to intervene early to try and mitigate those. So the Quick Start Guideline for Office is a free resource on the MSD Prevention Guideline for Ontario website. It includes 8 posters on computer workstation setup and best practices for MSD prevention in the office as well as in the remote office. So these principles will apply if you're working from home at different locations or if you're in the office. Next slide. So this is an example of the content included in one of the posters called Support the Body. And it just highlights that a well-designed ergonomic office chair is a critical component of the office and it's used for full-time office and computer work to support the body in ideal postures. So we've provided a list of free online resources for more information on promoting mental and physical health for remote workers. The first is the Musculoskeletal Disorder Prevention Guideline for Ontario. Secondly, Guarding Minds at Work is a set of resources designed to assess and address psychological health and safety in the workplace. The 13 psychosocial factors for psychological health and safety in the workplace. This was mentioned by Dr. Bigelow earlier. And the last one is the Health and Safe Telework Technical Brief that was created by the World Health Organization and the International Labor Organization. Thank you very much for your time today. And if you have any questions, feel free to ask.
Thank you so much, Kim and Phil. And we will go to the chat to see what questions you've stimulated from our participants. One of the questions that has come up related to hybrid work is, would you recommend that a hybrid work policy be developed, or is an MSD prevention policy enough?
I'll take this one, Phil. Based on our recommendations for management, commitment, and leadership and transparency, I feel like it's very important to have a policy that explicitly states the expectations around working remotely or even a hybrid working arrangement, just so that employees are clear on what the expectations are and how the model is going forward.
And given that, do you think there would be a template that organizations could follow that would integrate MSD prevention as well as some of the considerations from here related to hybrid work?
Definitely. So if we're looking at mental and physical health through MSD prevention, maybe looking at individual policies, it's just dependent on, I think, how the organization outlines their policies, but looking at how that falls within different policies, right? So integrating remote working or hybrid working into mental health and musculoskeletal disorder prevention policies in the organization.
Thank you, Kim. When the injury claims data was shown, did it include both work and non-work related claims? Do you recall for the hybrid work? There was the physical injuries and then there was the mental and cognitive injuries.
I'm just verifying the question in the survey.
Okay.
It was, have you experienced pain in the following body regions during the COVID-19 pandemic? So this was just for working from home.
Okay, great. And Carrie's indicated she might have missed it. Were the pre-pandemic measures actually measured pre-pandemic, or were they based on people's recollection of how pre and post compared?
Actually, they were based on the recollection. It was a one-shot cross-sectional survey, so we asked them how they felt prior to the pandemic. Yep.
Okay, and I'm just looking to see if there's been some other questions. I think you addressed was the laptop used with external components. Was that question asked? And you certainly addressed using a laptop with external components. Was it asked directly if you used your laptop with external components?
Yes, it was. So the first question that we asked respondents was, what devices are you using in the home office? And then the second part to that question was, for each device they reported using, what external devices are you using with that specific device? So I will be presenting results more pointed towards that area in the upcoming webinar in January.
Great, thank you. And can you just remind everyone how far into the pandemic this survey went out?
It was from the beginning of March to the end of May 2022.
Any other thoughts that either you or Phil have based on the findings from this survey, things that jump out that we should look at in the field to help people who are now going to be working in a hybrid arrangement?
I could talk about one thing. I think certainly a participatory approach seems to be the way to go in this. I mean, the findings show that being engaged with the organization, organizational culture is important. So the Elon Musk way of getting people back to work is not really the best approach. It is more of a participatory and making sure people are supported. We saw that fact that if workers are requesting something, that's not the best approach. It's best being proactive because then you have improved mental health, less pain if the workforce is proactive. Yeah. Kim?
Thank you, Phil. And what jumps to mind then is, employers worry about, how do they support workers, and where does their liability come in? Kim, do you have any thoughts on how CRE-MSD might be addressing this in future?
Yeah, so when it comes down to the employer's responsibility to protect workers, like I mentioned, MSD hazard should be treated like any other workplace hazard, even if it's in the remote office. So there needs to be plans in place to go through hazard identification, allowing employees to be able to report hazards and symptoms for intervention, and then assessing and controlling those hazards.
That's great. Thank you. And I know CRE-MSD is also going to be looking at the theme of liability, and some employers have been afraid to provide equipment. Others have come online, as was mentioned, virtually doing an ergonomic assessment to look at the setup to help their employees. Eileen's mentioned that Ergo Chair from her organization was provided, and Ergo setups was provided using Teams. So that's something that people can certainly consider. And Carrie's asked a question, do you have any thoughts on why, if the pandemic caused such distress, and why so many people still want to work from home?
I have maybe some anecdotal response to that. I think the issue with the stress and the mental health piece, I think it was because the pandemic forced absolutely everyone to go home, whereas some people have expressed preference in being in the office. So I feel like, the fact that it wasn't a choice, it was, this is what needs to be done. And there wasn't a lot of preparation around planning for this. I feel like it all happened so quickly, and I think the negative responses are probably due to a combination of those factors.
Thanks, Phil and Kim. And I just wanted to point out that Michael's let us know that in Ontario, the Ontario Health and Safety Act does not apply to work from home, but WSIB may approve a claim if it is in the course of employment. So if you are working at home, as we saw in some of this data, claims have been recognized and supported by WSIB.
Yeah, that's a good point. And, I think it's interesting. I think we've heard anecdotally that some employers are like, if you come back to the office, get an ergonomic assessment of your office at work, but they're not doing that for home, for people's, in that a hybrid sort of thing at home. So it's almost like employers have to remember that people are going to be doing this hybrid thing. They have to take care of people both in their offices in the office, but also still provide them assistance at home.
Absolutely. Absolutely. A research related question, an excellent question. We often talk about limitations of our study, Did we identify any sources of error in the study or this survey?
Yeah, I think, I mean, we do have a number of sources. It means this is self-reported data.
Yeah.
And as was brought up before, this was a cross-sectional study where we're asking people at the time, this was during the pandemic, we're asking them about their feelings of mental health prior to the pandemic, even though, I mean, that's going retrospectively. So there's going to be some potential for bias in response, because we're asking it at one point in time, and they're trying to think of what things were like prior to the pandemic. So that's a big source of bias, I think,
Mm-hmm. Mm-hmm.
uh, being it's self-reported. But this is fairly standard with all these questionnaires, right? It would be nice to do a follow-up studies, and I know the of Dr. Yazdani and the group at Conestoga did they did a panel kind of study. So they did it a few points in time, asking self-reported questions, but at least they're doing it in a few different times. So that is one way around that. Yeah, there's a bunch of errors
So the post-pandemic comment you've made, Phil, is very interesting. It'll be um, very informative if there was a post-pandemic, when we actually can say we're post-pandemic, to look at what employers did integrate as a result of these findings, and what gaps still exist, and why are there gaps? Is it because employers don't feel they have the resources, the time? So that's certainly something for us to look at in the future.
Yeah, it's interesting, and always there's this issues of when you're asking people, because we have that question on preferences, right?
Mhm.
Um, but preferences doesn't translate into behavior. That's the one issue with when you ask people preferences. Yeah, I'd like to do this, but in the end, sometimes, I mean, sometimes those don't match up with actually what people really do. And I think that would be interesting to look at too, is what really is happening, but it's complicated because there's a lot of pressures on them either way, from the employer, from their families, to do certain things, and that doesn't sometimes match up with their preferences. So yeah, it's very interesting.
Absolutely. Thank you. I want to thank both Kim and Phil for just an excellent comprehensive overview of the results from this survey. It is extremely helpful to employers and employees. And along this theme, I'd like to encourage all of our participants to continue to join CRE-MSD January, February, and March, as we will have more webinars focusing on this theme of hybrid work arrangements, starting with a webinar from Kim on using mobile devices at multiple locations and the prevention of MSDs. So thank you everyone today for joining us. Was thrilled to have everyone on a Friday, and we hope you have a wonderful weekend. And don't hesitate to send any emails to either Phil or Kim if you have any additional questions. Thank you.
Thanks, everybody.